Sputnik. Well, we haven't seen all that many flu cases the last couple of years, as we've been saying, because everyone's been wearing a mask and the COVID precautions with social distancing.
Yeah, and that has felt pretty lucky, especially for parents with young kids who seem to always get sick. But this year could be different. Dr. Gautam Desai with Kansas City University joins us live this morning with some tips for flu season. Good morning, Dr. Desai.
Good morning, Abby and Pat.
Glad to see you again. There's been a lot of talk about Australia's severe flu season. Obviously, they just finished up their winter. So are we looking at the flu making a big comeback here this year?
Yeah, sometimes we can learn some information from what occurs in the southern hemisphere. And this year, that flu season down there began sooner and hit kids especially hard, especially those between the ages of 5 to 9 years old. So, we're preparing for what may be a bad flu season this year.
Now, what's interesting, Dr. Desai, we've all, the last few years during the pandemic, been forced to sort of get a crash course in vaccines and how the COVID vaccine, would even maybe lessen the symptoms if you did get it. Dumb question, is the same thing true of the flu shot? Like, I know sometimes they say, oh, it wasn't an exact match, but are you better off having it than not, God forbid, if you get the flu, you know what I mean?
Yeah, that's a smart question, Pat. And if you're an adult and you get the flu shot, you have a 26% lower risk of needing admission to the ICU and a 31% lower risk of dying. Kids have a 75% reduced risk of getting severe life-threatening complications, including death from the flu. And pregnant patients have a 40% risk of needing to be hospitalized. And that shot also helps their newborns who can't get the flu shot for their first few months of life get some protection as well.
This is the time of year when we start seeing flu shot clinics up everywhere. We're going to have one here in
the 26th.
26th in a few weeks. They're having a pediatrician's office. Is this the time to get one?
Yeah, last year Pat made me sing him Shakira and said wherever, whenever. Usually around Halloween is a great time to get it, but since it began a little bit earlier in Australia, if you have a chance to get a shot now, this would be a great time to do that.
Okay.
I was expecting a little Shakira at the end of that, but that's okay.
Right.
Can't get lucky twice.
For your viewers, yeah.
Yeah. And how about this, Dr. Desai? What are the differences in the symptoms? But I know it's probably hard to distinguish between COVID and the flu. I'm sure we're going to hear lots of people saying, "Is this the COVID or is this flu? I don't know what I have."
Yeah, that's why it would just be a great idea to get this shot and avoid long waits in the hospital emergency room. So getting protected against COVID and the flu would be great because it's very, very hard to tell the difference. They're both viral infections and they have similar symptoms of fever, body aches, coughs, and colds. So it's really, you can't definitely say someone has COVID or flu just based off of their symptoms. So that, free or really cheap shot can probably save you a lot in co-pays in the ER should you be unfortunate enough to get it.
Yeah, the one thing they do have in common is the brain tickling testing situation.
Yeah.
Both get the
We've
swab
all
up
become
the nose.
experts in that, too.
Yes, we have.
Yeah.
All right, Dr. Desai, thank you for joining us this morning.
Hey, thank you both. Have a great week.
All right, you too.